So let's take a look at the localizer just real quick. Right here, you can see the L spine, so L5, 4, 3, 2. Basically right here is that defining curvature separating the lumbar spine from the sacrum. So down here you have S1, 2, 3, and likely 4 over here with a couple, anywhere from 3 to 6 coccygeal bones right here. So this anterior aspect of S1 right here is the sacral promontory, and because of that, this angle formed between S1 and L5 is called the promontory angle. Okay. So let's take a look at the coronal plane. So here we can see the entire sacrum. In here we can see S1, 2, 3, 4. Obviously it's curved, so that's why we don't see most of S4 and whatnot. Over here we have the ilium, and over here as well, basically where the sacrum articulates with the ilium is the sacroiliac joint, known as the SI joint, bilaterally. So over here we can see the sacral foramina through which these sacral nerves course through, these little gray lines right here. Sacral foramina. These are formed by the transverse processes of the adjacent or sacral vertebrae, sacral bodies. Now the transverse processes come over here and they form these lateral masses, also known as the ala over here. Okay, you can see that bilaterally. Okay, let's see. Do we have the sacral canal? Right here is the sacral canal, just like the spinal, or the spinal canal of like the lumbar spine, thoracic spine, all that stuff with like the CSF and the spinal cord and all that. We have the sacral canal as well, which houses nerves and CSF, and it actually terminates right over here around S2, S3. This is where the thecal sac terminates, right in here. Okay. Let's see what else. Let's look at the axial. I'm actually gonna go with the T1. T1's better for anatomy. Okay, so starting at the bottom down here, you can see the coccyx right there. All right there. Looks like we have the cornu right here, or cornua bilaterally, which attaches to the sacrum, basically. So now we have like the sacrum and whatnot. Here the sacrum is much wider than the spine, and you'll see that shortly. These are the ala, or part of the hip bones. So sacrum right in here, ala, sacroiliac joints connecting the two. In here you can see that triangular sacral canal. That's what I was discussing earlier, that houses the sacral nerves and the thecal sac. You can see it very well right there. And up here you have the sacral promontory, like right in here. So now we're in like the lumbar spine and whatnot. Okay. Here you can see the spinous processes still, and I can't really remember. Over here you'd have like the ala. This would be a slice right through the sacral foramina, and you can see some of those sacral nerves coursing through right there. You can see that. I think that's really it. Any questions?